Welcome to the Guide to Wellness podcast. I'm your host, Susannah Freeman, licensed acupuncturist. In these conversations, we blend the wisdom of traditional Chinese medicine with the innovations of modern functional medicine, offering practical insights and tools for a life of wellness. Our vision is to contribute to a healthier world by providing accessible knowledge, tools, and daily practices. If you're ready to adopt new health habits and do things differently, then listen and learn here. Hello everyone, I'm Susannah Freeman, licensed acupuncturist and clinic director for Guide to Wellness and Great Turning Healing Center. We have here in the studio with us our very own Dr. Breana McElgunn, naturopathic doctor, aka Dr. B. Since Dr. B and I discuss hormone balance every single day in the clinic with our patients, we thought it was high time to bring the discussion into the podcast.
Susannah, I'm very excited to be having this conversation today.
Me too. Let's go. In this episode, we want to demystify perimenopause in particular and let you know it's a real thing. Indeed. And what are the physiological changes underlying these symptoms? And later in the show, what can we do about it? And we want you to know there's a lot that you can do about it. With this series of conversations, our intent is to demystify both perimenopause and menopause. We'll also touch on cortisols, testosterone, thyroid, and insulin along the way, since as you know, we are complex creatures and our body systems are interconnected. When one part of the body changes, it will generate a chemical and physiological signal that will influence other parts of the body. So for now, we're talking about the female body. If you're male, you'll understand more about the women in your life, as well as appreciate the various signals and hormones and balancing that needs to happen in your body as well. Dr. B, you have so much experience with hormones. Will you please share with us your perspectives on the female menstrual cycle, and how can we say, to be a little cheesy, how can we be in the flow with all its many seasons in life?
Exactly. Well, Susannah, I've been working with women's hormones for over 22 years. One thing that might be confusing for our listeners is, what is perimenopause? Perimenopause is the time in a woman's life that hormones are changing, but it's not necessarily affecting every aspect of her body, or maybe just her period flow is changing. Maybe she's getting some sleep issues. I like to think about perimenopause as the prelude to the more intense menopausal transition that most women are familiar with, the hot flashes, the night sweats, and more acute period changes. I have often described for my patients that our menstrual lives are like we're on a train track, or as I like to call it, the menstrual track. And when we're in our teens, 20s, 30s, we're chugging along. Things are pretty predictable, no real differences. And then we might encounter a little bit of a train track tunnel. And maybe that tunnel lasts a month or 2 months. And maybe something's a little bit different. Your period showed up late. Your period's a little heavier. Well, as we're on that menstrual track, I think of perimenopause as a series of maybe short, small tunnels where things are a little bit off and it's new and unfamiliar. And we're going to talk more about that menstrual track analogy later in the show.
Cool.
I also think about perimenopause as a state of being. You're not going to be perimenopausal forever. Just like if you've ever had a pregnancy, you won't be pregnant forever, even if you feel that way.
So these are the seasons we've been chatting about.
Absolutely.
Okay, cool. All right. And so
these tunnels can show up as, I just don't feel like myself, but it's somewhat vague. Or maybe there's a very definitive symptom that is changing. And being able to be the conductor of your train and work with our healthcare partners, you in your Chinese herbal and acupuncture, myself in the naturopathic medical world, that's really going to help stay on your menstrual track, despite the track maybe trying to get a little curvy or uphill or just really unfamiliar territory.
And a reminder that none of this is a disease.
It is not. We don't have to cure perimenopause.
Right. So we might think of this as this alarming diagnosis or God forbid we go through menopause, and yet it's just a season and a chapter in our lives, and to be celebrated in lots of ways. Right?
Absolutely.
Yeah.
Like puberty was a chapter and a season in our menstrual life.
Yeah.
This too is a chapter or season in our life.
And there's so much to gain from it. Love that. Okay, so let's chat about what this might look like. And keep in mind, people, that there's a lot of overlap with perimenopause, menopause, and postmenopause.
Absolutely.
So Dr. B, treat me like a patient for a minute.
I will absolutely do that, but let's also keep in mind that these changes that you have experienced or our listeners are experiencing are unique to each woman, and they're not going to, they're not abnormal. All of this is a constellation of how our bodies change as we age. So, Susannah, if you were my patient coming into the office.
Oh, Dr. B, I just have had the worst few months ever. My cycles are all over the map. First, I'm like, can't stop bleeding, and it's heavy, and I'm just so tired all the time. I'm irritable. I'm short with my kids. I'm not in the mood to be with my partner, sometimes maybe not even in the same room. I don't feel like myself.
Absolutely. So tell me more about how your period is changing. Is it getting more frequent? Is it getting further apart? Are both of those?
It's both. And I have pain. Sometimes I'll skip a month and wonder if I'm pregnant. And then I'm gushing. And I just don't know what to expect.
These are very normal, appropriate changes that we can get on top of so that you feel more comfortable day to day. Are you having any issues with your sleep?
Yes. How'd you know? I wake up at 3 a.m.
Are you having any temperature changes?
If I've had a glass of red wine,
oh,
that'll do it.
The red wine,
yeah,
absolutely.
And I'll wake up with a night sweat.
Absolutely. Have you tracked
that was just a menopausal thing, night sweats?
Absolutely not. Night sweats can happen after we've had a baby. They can happen at any time in our premenstrual stage before our period starts. They can happen because we didn't eat the right things or didn't get enough exercise or we're stressed about something. So these are things that we can identify and work with. How do you feel your brain is working?
Are you reading my mind? So I used to be able to focus really well. And now if I don't write it down, I forget. And I'm just not as focused as I used to be. It's more work. And I'm worried that I've got dementia or something.
What about your memory?
It's tricky. Like I'm forgetting stuff.
Writing lists, lots of lists.
I write lots of lists, yeah. And then I lose my list.
How is your mood?
Well, and by the way, folks, this is not happening 24/7 in every person all the time. We're just giving you the highlights. Okay, so back to me, the patient. All right. I've been pretty irritable. Like I said, I'm kind of short with my kids. My partner is a little worried about me. I don't feel like myself.
Have you had any changes in weight?
Yes. Like I used to have this like amazing flat belly, and now I just don't feel like I can lose that 5 pounds. And it's all focused here in the front of my belly, or my hips.
Ah, yes, the menopausal muffin top.
Our
muffin top. As our hormones are changing, as they're being variable, we can see fat changes as well. And so common is it's going to land right in the belly and be squishy and uncomfortable. And this is why I call it the menopausal muffin top.
So is this it for life?
No, not at all. Again, remember, we talked about this as a transition, a season of supporting you through this transition, optimizing your wellness, and we're going to talk more about different strategies that we can use.
So it sounds like you can help me.
Absolutely.
All right, back to me as a provider. Okay, here we go. So this sounds mighty confusing. Can you tell us more about what to expect and what to do?
In my experience, menopausal changes can happen as young as age 35, 36, 37, and they can be as late as to be 55, 56, 57. That's 20 years. So these types of symptoms can be confusing because they can overlap to other systems. We might have stressors in our life and we think, oh, these symptoms are because I'm stressed. Or maybe your diet isn't as great and your blood sugar is changing. And we're going to talk more about that. There's also cultural concerns, and in many different instances, women are looked down upon or shunned that they're going through this transition and that they're experiencing these symptoms. And again, I can reassure you that these are normal transitions. These are appropriate. They can be very uncomfortable symptoms that we will work on to stabilize, but they're very normal for every woman to go through in some fashion and some severity.
And sometimes a woman will go to her doctor and ask about this, and she'll be told to come back once she's not had a period for a year, because that's when she's menopausal. And then she'll get that diagnosis. Back to the train analogy that you gave us, at that last train station, she didn't know it was her last station until now, a year later. Sometimes that term menopause is insufficient to describe a woman's experience on their track.
Absolutely. We don't know that that was the last menstrual period until months or a full year or year and a half later. Missing out on an opportunity to intervene and support and improve your overall wellness and health is what this podcast is about, to educate folks and help them to seek care even before their periods have stopped.
Yeah. I don't know about you, but I like to think of my experience. Now I'm in my early 60s, but I started training for this in my early 40s. Knowing that I was going to become menopausal, I was like, well, I know what I need to do here. And I started taking herbs and paying attention to my stress levels and my nutrition, knowing that my hormones were going to change.
Absolutely. What a great proactive approach you have taken. And this is really what we're talking about for our patients, is come in when things start to shift so we can get back on track.
So, Dr. B, if you don't mind me bringing in some of your personal experience, there was a time in your life when you had a big traumatic experience. We knew this was happening. Do you want to tell us a little bit about how this influenced your hormonal world?
Absolutely. So about 3.5 years ago, I had a very tragic, unexpected event happen, and I was 46 at the time. And that event, that tragedy, really shoved me more aggressively and more deeply into that perimenopausal transition, and my symptom frequency worsened, the intensity worsened, and it was really uncomfortable. And I had also been preparing for that menopausal transition, using different herbal and nutritional formulas to help keep me on track. And once that tragedy happened, I had to step up my intervention and recruit other providers to help me stay on my menstrual track as well.
Which we did. And because we knew you already, it was really easy to just jump in and give you some herbs and to know immediately what we needed to do to help prevent that collision in your body.
Absolutely.
Because stress will affect these hormones.
Stress is a huge factor in this equation, and we all have stress on varying degrees. It can come and go, and it can also be incredibly unexpected.
Yeah, and because of that, I can see in working with you over the years that you really have improved and smoothed out all those bumps, and now here you are on the other side, and much stronger and much more able and much more at ease, which is super cool.
Absolutely. Having that proactive approach in our 30s or even early 40s helps us to prevent becoming a quote-unquote hot mess of hormones.
Yeah. It reminds me also of this one patient we had who was working with us, and she was high estrogen, And then she also had a major trauma in her life, actually her partner's life, and where she then became the caregiver. And within a very short period of time, she dropped into low estrogen. And we believe, we'll talk about this more later, but because all of those hormone pathways that had been feeding into the estrogen were now feeding into the cortisol pathways, because that's what she needed in that moment to save her husband's life.
Her hormones diverted into what was the priority
Right.
at that time.
And then once we were able to test that and to recognize, this is what just happened, then we were able to apply the appropriate treatment, and now she's just fine.
Absolutely.
Cool.
And sometimes in this instance of the patient, going from an elevated estrogen level and a dramatic, rapid decline into low estrogen can really create a treacherous, dark, uncomfortable tunnel on our menstrual tract.
And sometimes these traumatic events lead to some times of turmoil, and then when we apply the right treatment and have a chance to reset and get caught up, they in hindsight can see as a blessing and something that's absolutely easy to regain your balance from.
Absolutely.
Cool. That was a lot of talk about all the things that can go wrong. Let's talk into the science and the clinical patterns of the hormones, and then let's talk about how do we stay well through these changes. So, Dr. B, we have hormones in every tissue in the body. We hear about estrogen, progesterone, and testosterone. We also hear about cortisol, thyroid, insulin, and melatonin. These are all chemicals in the body that act as signals. We produce these hormones from the food we eat, and our ability to manufacture these chemicals in the various organs in the body. For example, estrogen is made in the ovaries, but also in the fat tissue. You're really good at explaining hormones. Can you narrow down this conversation for us so we can understand better?
Absolutely. One of my favorite analogies is thinking about how hormones interact with each other, as well as how hormones are unique, and each glandular system, the adrenal glands, the thyroid gland, the ovaries, make their certain set of hormones. And when we think about all of those different glandular systems, they are interacting together. I like to use the analogy, 3 legs of the hormone stool. If one of those legs wobbles, the other legs are affected. Our primary legs are thyroid, adrenal, cortisol, meaning the main hormone from the adrenal glands, and then our ovarian hormones, as Susannah mentioned. Estrogen, which also primarily is estradiol, our most potent estrogen, is really what we're talking about. There are 2 other estrogens that play a very minor role in the menopausal transition, but estradiol is the main player. And then, of course, progesterone and testosterone from the ovaries as well. If we use that hormonal stool analogy, we can think about there are at least 3 more secondary legs, but there's actually more than just 3 additional secondary legs. The liver factors into this equation by breaking down the hormones, metabolizing the hormones, making proteins that transport the hormones throughout our body. The pancreas, glucose, insulin being produced from the pancreas, and how it regulates our blood sugar with minimizing spikes in our blood sugar as well as dramatic drops in our blood sugar. Our gut, fun fact, makes 80% of our serotonin that our bodies require. The brain being a big user of serotonin, but the gut is who's making that for the brain to use. And of course, the brain itself factors into an additional hormonal leg, as does the heart. Each of these organ systems, these secondary legs of our hormone stool, are going to be unique to each woman and where additional symptoms might be affecting those different organ systems.
Nice. Well said. Then we want to get into the specifics of the ovarian hormone balances that can lead to symptoms with perimenopause. So when we're thinking about a woman who is reporting symptoms, this is what we're thinking about. This is where we test to confirm or to refute our clinical suspicions. So tell me more.
We might say test, not guess. Testing hormones, blood testing for thyroid hormones, salivary or urine testing for adrenal hormones, blood testing, saliva testing, or urine testing for ovarian hormones. When we test, we can understand what's happening for each woman and the symptoms that she's experiencing.
So you mean not every woman who comes into your clinic reporting perimenopausal symptoms or menopausal symptoms has low estrogen?
No, she may have high estrogen. When we factor in these additional hormones and the interplay of these additional hormones, I like to think of that interplay as a dance, as we think about the dance partners being estrogen, progesterone, testosterone, cortisol. How is that dance partners dancing with the others? And are they all dancing to the same song? Are they all dancing to the same tempo? So testing really helps us to determine how to intervene appropriately to get that woman back on her menstrual track and really accentuate and improve her overall wellness.
And a little tidbit to remember when you test your blood or your saliva, day 19, 20, or 21 if you're having a cycle.
Yes, when we're getting the best useful clinical information, when we collect that test sample on that day 19, 20, or 21 of the menstrual cycle, that allows us to see what the interplay or dance is between progesterone and estrogen specifically.
And if you're not having a cycle or it's irregular, which a lot of our patients have an irregular cycle, then we just do our best and we can work with the information you've got.
Absolutely. If a woman has already stopped her periods, we can test on any day.
Okay. So, Dr. B, what are some of these symptoms and how would you, in your clinical experience, know what to test? For example, maybe progesterone is low. What would that look like?
Well, the top 3 symptoms of low progesterone that I've seen working with patients, going back to us playing the role of pretending to be a patient.
I'm throwing my covers off at night.
Night sweats is a huge one. When I hear a patient talking about night sweats, I immediately think likely her progesterone is lower than it should be. And again, testing helps us determine how low. Also, just in general, not sleeping. That might show up as difficulty falling asleep or just being really wakeful every night, waking once, twice, 3 times, 4 times at night, or struggling to get back to sleep if she's only woken up. And then also another low progesterone symptom that's very common is the brain being overly stimulated, and that can show up as anxiety or feeling tense or nervous or even having racing thoughts. So those are the top 3 symptoms that I think about that would be correlating to low progesterone.
And just to make the pond a little muddier here, that could also be cortisol being off. That could be blood sugar being off. And in traditional Chinese medicine, there's a whole clinical picture going on there as well. So what we like to do is to tie into the hormones and all of the different systems, all the different legs of the stool, and then also bring in the traditional Chinese medicine clinical diagnosis.
Absolutely. That collaboration between naturopathic medicine and traditional Chinese medicine is just a beautiful dance.
So progesterone could be low. Estrogen could be low.
Absolutely.
What does that look like?
Low estrogen. If I have a patient coming in talking about different symptoms that would make me think about low estrogen, the things that I normally or commonly hear is weight gain, that belly fat, that menopausal muffin top, and no amount of exercise or dietary changes is making a dent in that weight gain, which is so frustrating for women. Yeah. Another very common symptom associated with low estrogen is depression. Your brain just struggles to find the joy and the pleasure in life. And that has varying degrees of mild to even very severe for different women. It's almost like the brain just can't find the joy. And then a very common third symptom is fatigue. And that fatigue can either show up as mental fatigue, their brain is tired, or it may show up as physical fatigue. The arms and the limbs and the legs just feel heavy.
Yeah.
It's difficult to carry in your groceries.
Right.
It's difficult to go up the stairs. So that general fatigue that doesn't seem to change if the sleep is, if you get more sleep or deeper sleep.
And it can be disconcerting if you used to have a lot of energy and you bounced up the stairs. So don't despair, folks. There is a way out, and this is temporary, and it doesn't happen for every woman all the time, and it's super changeable. So you mentioned low progesterone and low estrogen. I know that things can be high as well, like high estrogen. What does that look like?
High estrogen has its own unique set of symptoms when I hear a patient talking about these different things. A very common one would be like irritability, anger, rage, just feeling so much intensity of emotion. And it doesn't seem to be related to a specific event or situation that might be causing that. So flying off the handle, being really agitated with their kids, less patient. Another thing to go along with that is just outright mood swings, to go from a comfortable, pleasant, stable mood and swinging into that anger, irritability, aggression, again, without a identifiable provoking event. I also see a lot of headaches with high estrogen. They could be migraines, if women are susceptible to migraines. It could be a general tension headache. It could be that feeling of your eyes being strained and tired, from being on the computer all day. And that might be new and different and something that's not been happening before with that eye strain. Another very common symptom for high estrogen is an elevated heart rate. Sitting and relaxing, and your pulse, maybe you've got a Fitbit or some other type of monitor, and you might see your pulse be at 85, 90, 95, and you're at rest. That's an uncharacteristic symptom for most women, and it could be an example of elevated estrogen, high estrogen. We do see some overlap between high estrogen and high testosterone.
Interesting.
For women, our testosterone tends to be fairly level. It doesn't go with a lot of highs and lows like we see with estrogen and progesterone normally in our menstrual cycle. So a lot of times we need to determine if the symptoms of high estrogen or high testosterone are overlapping. Some symptoms that we can see with high testosterone would be a general sense of edema, puffiness in your legs or your hands or around your face. That's a common high testosterone symptom, as is unwanted hair growth.
Oh no.
Here's the whiskers or the mustache or the sideburns showing up on our face, which generally is incredibly unwanted for most women.
So there's a way out of that too.
Absolutely.
Cool. And then there's stress-driven changes like we've touched on a few times here, and how cortisol can now play into estrogen and progesterone and testosterone. Tell us about that.
Cortisol, being the primary adrenal stress hormone that our adrenal glands manufacture and secrete when we're under stressors. When our adrenal glands struggle to make enough cortisol to manage and navigate the stressors we're under, progesterone can then be converted, or as I even like to say, diverted into making more cortisol. That is a biochemical pathway. When we have high stressors and our adrenal system can't keep up, progesterone is sacrificed to manufacture that cortisol, which then further complicates our hormone picture because now our progesterone levels are falling.
Which looks like can't sleep well at night and night sweats.
And that general feeling of
picture's
tension.
Getting a little more clear here.
Yes, so thinking about how that interplay, that three legs of the hormone stool, that cortisol ovary interaction, or dare we even say a tug of war?
Yeah.
Who's winning that tug of war?
Interesting. All right. And then you might bring in the thyroid here.
Absolutely. Again, going back to the three legs of our hormone stool, when one of those hormone legs wobbles, the other are affected. I've seen many women, when they're in a high stressed state, that their thyroid hormones begin to decline. And now they're having additional symptoms based on the thyroid hormones declining. We can also see just the perimenopausal transition trigger a underactive low thyroid response. Very, very common to show up for women in their menopausal transition. Now they develop a hypothyroid state.
And I'm going to be the patient again for a moment. Dr. B, my brain doesn't work anymore. What does that mean?
That can absolutely mean that hormonal change is further aggravating a thyroid hormone issue, and the decline of thyroid symptoms is worsening the brain and the cognitive struggles a woman has. So again, this is where we go back to testing. And I am a huge advocate that not only testing thyroid stimulating hormone, TSH, for thyroid function, I also test free T3 and free T4 to get a really comprehensive thyroid picture for my perimenopausal patients.
And those tests are not expensive.
No, and it's a simple blood test that can reveal a lot of hugely useful information.
Yeah, really nice to have. Wow, that was a lot. So there we are. I kind of feel like I'm in a little tunnel myself here, girlfriend.
Yes. So when we look at those different series of tunnels on our menstrual tract, if we support the thyroid function, that's like putting lights inside your tunnel, so it's less dark.
Cool.
And we can see the path that we're on more clearly. If we're supporting and intervening with the adrenal system and cortisol, it's like straightening the track, making it less curvy or less steep and less treacherous on our menstrual tract. We also, both with thyroid and adrenal intervention, we're shortening those tunnels. So it's not 18 miles of treachery. It might be only a half a mile, which for a lot of women is tolerable despite it being a rough patch that they're going through.
And that's what we did with you when your house burned down.
Yep.
And you got bumped into menopause quickly.
Shoved into menopause very quickly.
When you helped me through some rough times when I was going through perimenopause, and you shortened the tunnel for me. That's what we did for this patient who helped her husband in a life-threatening situation. We shortened her tunnel and helped her come out the other side.
Yes.
Cool. Okay.
Less treacherous, light up those tunnels.
Okay. So that complexity is starting to make a little more sense. Can we chat now about how do we generate well-being through this process? And like we said, we want to shorten that tunnel. We want to smooth out the tracks. We want to make things smoother. In traditional Chinese medicine, we talk about the smooth flow of qi, and that is what leads to well-being. So we're going to talk about that in a little bit more. But what I really would like to swing back to right now is how we do this best with a collaborative process. When you as the patient are involved in your own healthcare and you have a team that is responsible for guidance, understanding and interpreting your labs and your medical history, and then providing treatment recommendations with herbal medicine, nutrition, acupuncture, and herbs, possibly hormone replacement therapy if that is something that's necessary. Dr. B is a fabulous expert in that. So just to reiterate, you are responsible for your nutrition, your well-being, your sleep, your exercise, your self-care. We can step in and help you as part of a team to help guide you so you're not spinning your wheels, you're not stuck in the tunnel too long. We make things easier, but you're actually doing the heavy lifting and we're doing the guiding, and that can mean that your load is far less.
Absolutely. Collaboration with multiple healthcare members of your team, as I like to say, we all are going to be in the same sandbox, helping you to be your best self. But no one wants to have someone throwing sand in that sandbox.
Right. It doesn't help, does it? Yeah. We all want to work together.
Yes.
And then something that's not on people's minds in this country and in this culture as much, but can be really, really helpful, is to pull in the wisdom of traditional Chinese medicine into this collaboration and addressing your unique constellation of symptoms. So there's lots to say about this. We could do a whole episode just on traditional Chinese medicine and how it views perimenopause and menopause. But briefly, in traditional Chinese medicine, and stay tuned, by the way, for our menopausal conversation. We'll have more detail on this. But kidney yin is declining with menopause, and that is it's a completely normal, non-pathological process in the body.
Again, we're not trying to cure menopause.
Right. We're not. In fact, I'm kind of enjoying it. All right, so we talked a little bit about the liver earlier as one of those secondary legs to the stool, and this is where Chinese medicine can really shine, is in keeping your liver happy well into menopause so that these symptoms don't become such a big deal. And the kidney yin can decline, and it's not a problem because the liver is so happy. And remember, I'm not talking about a disease, I'm talking about the processing of the liver, the regulatory process. And in Chinese medicine, we call that the smooth flow of qi, which is a really nice metaphor.
Mm-hmm.
Okay, so you might have blood deficiency, which could look like anemia. You might have liver yang rising, which looks like that high estrogen, irritability, rage. You might have low progesterone that leads to a night sweat. That's what we call liver yang rising. You might have digestive issues and that menopausal muffin top, and we would look more at spleen and stomach qi deficiency. So there are lots of different Chinese medicine patterns that are playing into this that we're going to diagnose you with both the hormonal overlay and the Chinese medicine overlay, and we're going to put them together. And the really fun thing about being an acupuncturist these days is how I get to play in both worlds and they actually speak the same language. But to any given patient, it might not make sense. But to you and I, Dr. B, it does. So we're going to be talking about liver qi stagnation during menopause and during perimenopause, and we're going to make sure that that liver is as happy as we can possibly get it. Super fun. So we're going to use acupuncture, we're going to use Chinese herbs, we're going to chat with you about sleep patterns and habits and self-care. We're going to use lots of nutrition to correct those hormone pathways.
One thing that I have really appreciated personally is how I can use my knowledge in Western herbs and collaborating with you, Susannah, in Chinese herbs, and how beautifully and synergistically blending the Western herbs and the Chinese herbs can really provide so much stable and comfortable hormonal transition.
Yeah. And then we can go back and forth with people as they need more of your skills or more of my skills. And then let's not forget that foundational nutrition that you and I both love to talk about.
Absolutely. Are you drinking enough water? Are you taking, necessary nutritional supplements, vitamin D, vitamin B12, iron? When women have changing period flows and they might be really heavy at times, that iron deficiency plays a substantial role in fatigue and brain fog, body aches, making sure that our magnesium and good fats are in the equation. Those good fats are so important.
Lots of protein.
Lots of protein as well. And then, Susannah, you touched on the self-care. Do you have a good sleep routine? Are you putting your phone away? Are you doing a consistent time of going to bed? Are you getting enough activity and exercise? Are you being aware of limiting and reducing your sugar intake, your caffeine intake, your alcohol intake? That red wine triggering those hot flashes does not work for a lot of women. Doing those consistent small things for yourself is really important. Consistency being the key word.
That sounds kind of challenging because, Dr. B, I've got 2 kids, I have a full-time job, my parents are needing more help, I would love to go on a vacation every now and then. How do you do all this?
I like to focus on looking at the different ways that I can support myself. If I struggle with sleep and I don't get enough sleep because my kids are needing my time or I need quiet time by myself, then I can use herbal formulas and nutritional formulas during the daytime to help support me in that transition. And, the Chinese herbs, again, personally, I love the Chinese herbs as I get to make my morning Chinese herbal tea concoction. And I know that I'm starting the day with a really good herbal nutritional boost that's not jam-packed with sugar and caffeine.
So you're feeding yourself first.
Yes.
Nice. Back to basics, feeding yourself first. And knowing that as you are filled up, then you have more to share with everybody else.
Absolutely.
Nice. Okay. So keep yourselves filled up with love and connection and self-care and exercise, even when you think you don't have time.
Absolutely.
Okay.
And then when you need additional support because some of those foundational things are not quite as stable as you would like them to be or need them to be, then we bring in, again, Western herbs, things like Vitex or Dioscorea. We look at nutritional interventions with DIM or B vitamins, vitamin B6, vitamin B12.
Right.
And then there are women, many of my patients, that hormone replacement becomes essential in reducing the treachery, the duration of these menstrual tunnels that each woman is on. And I predominantly use bioidentical hormone replacement therapy. And bioidentical hormone replacement means the starting compounds to make these hormones come from plants. And then they are laboratory created to mimic and be identical to hormones that each woman is manufacturing. So those hormones bind easily and readily to the receptors on each of these different cells and the different tissues of the body.
And you're giving those at a physiological dose to mimic what the body is already trying to do.
Absolutely. I'm not giving a 50-year-old woman hormone levels that she would have had when she was 20. That is way too aggressive. That can set that woman up for side effects, unwanted effects, or even change her risks for developing some really serious side effects.
So your goal is well-being.
Well-being. Giving her a dose of hormones that allows her to be more comfortable without overly stimulating her and giving her the right balance of hormones, which is really determined, again, going back to testing, not guessing.
And I really enjoy working with you over the years. There have been so many women that I've worked with, and they've started with me, and we've worked with them for years on just smoothing out this whole process, and that's worked well. And then sometimes they get to a place where it's just no longer working and they're exhausted, and that's when we call you in. We've probably called you in before at that point, but it's nice to know that we have this backup. If nutrition and herbs and your self-care are not enough, then we can lean into that, and we're always going to be letting the woman decide about her genetic history and how does she feel about taking medications. And some women want it and some women don't, and that's what we're going to be talking about in the menopausal episode, so stay tuned, folks, for that. But it's nice to know that we have that tool on our toolkit if we need it, or our tool belt, whatever you want to call it. And that not every woman needs that medication, but it can be a really nice place to receive that support. At the end of the day, it's still about foundational nutrition, self-care, and using herbs, right?
Absolutely. Those are our building blocks. Hormones, medications are really at the top of the intervention pyramid. And if we haven't done the foundational building blocks of self-care, nutrition, herbal medicine, making the right food choices, jumping right into the hormones will not be as successful as a woman would want.
Well said. So Dr. B, that's super, super helpful to understand that whole transition and what we can do in each step of the way, and to know what those tools are along the way. As you all know, our vision here is to be your home for natural health. So please keep in touch with us. Share this podcast with someone you think would benefit. Tune in to our next episode on Guide to Wellness when we chat about postmenopausal hormonal strategies. Till then, everyone, enjoy your day.